thinking about that client journey, and a lot of what we teach here is about digital marketing and how to get found by new clients. I would say for many practitioners, the biggest challenge to starting a new practice is getting clients, or in our case, getting clients consistently. Given that, depending on the type of therapy work you do, there is some natural attrition of clients. They could stay anywhere between 6 to 8 sessions or 6 to 8 years, and anywhere in between. But getting clients and then getting them consistently are kind of two different things. Competing as a therapist online is becoming harder and harder, especially with the entry of big venture capital driven companies like BetterHelp and Talkspace and whatnot. So they're driving up the cost of paid advertising tremendously like never before.
So, when it comes to medical marketing, I think it's important to kind of understand the client's journey. Definitely, a lot of times what people actually start there's a lot of Google data behind this. We're a Google partner agency, and we kind of worked with some of their data, and as well as just a lot of experience with what we've seen in the industry. But I would just tell you kind of the overview, and we'll put a few links in here to some presentations that you guys can get some visual, but now some people are just listening. So I'll try to make it so that it's as clear as possible. But I'll just give you the overview. When people start this kind of patient's journey, generally what they're doing is they're starting with a condition research. So they may not be starting out by looking for EMD therapy, EMDR therapy or something very specific like that. They're maybe looking for depression or anxiety, PTSD, something like that, where they know it's some sort of a condition, or like they may be even more general, like I'm not like how to feel better or something like that. It's very much talking about what is the condition research, and it's probably more general. I think that in this space, it's generally people know what depression is, whereas if you're dealing with dermatology, they may not know what it's eczema, they may just know it's itchy skin. But in this case, they're going to be starting with the condition research, and I mean there are numbers around these in the medical space in general, and it's usually about 25% of medical searches start with a condition research. And so then what we do is we basically look at like what is the kind of in the SEO side of the world, you need to understand like, okay, so what is your goal? Your goal is to attract new patients. You really need to kind of understand what is the audience. So what are the different people and personas within that audience that you might be trying to attract? And once you understand that audience, there's different personas. Maybe it's certain types of, you basically just kind of want to name who is your ideal client. You need to identify. Then you kind of go back and you look into what is the keywords that they're going to be searching for.